This fourth wave has not stopped. In terms of supporting other health authorities that have been overwhelmed, like the North, and in dealing with patients locally, we continue to have a significant burden of COVID disease in the hospital and in the ICU. This is not something, if one becomes seriously ill, that recovers quickly. It takes a long time and therefore consumes a great many resources in the hospital. As a consequence, our ICUs continue to be essentially overwhelmed. We're functioning, we're still maintaining capacity to admit, but it is exhausting, and morale continues to be good despite an incredibly, frankly, excessive workload that's sustained. People are done. My fear is that once this epidemic wave or the pandemic settles down, that I think many nurses are going to be looking to do other work. They are exhausted. At one point last weekend, each of our wards had only one RN on them because people had called in sick. They're tired. In terms of the intensive care unit, that's exactly the problem, is that we have a steady stream filling a reservoir and really just a trickle going out. It only takes 2 or 3 a week that are going in and 0 to 1 that are going out for it to become overwhelming. Even as COVID spreads through the vaccinated population, we know that vaccines are 90% effective. That means they're 90% effective in preventing serious disease. But if 10% of the Canadian population becomes ill, vaccinated population becomes ill with COVID, and 1% of those require hospitalization, we're talking tens of thousands of people. Mm-hmm. That's going to overwhelm our system. So even if it's just a tiny percentage that become ill, the impact is huge when they come in, but they don't leave for weeks. Mm-hmm. And it just sucks up these resources and is going to have a huge impact on access.